Welcome everyone, this is Pospo and BRAINCAST for Multi-Learning, one of the most important days of the year, International Women's Day. A great opportunity, and hopefully not only for a day, to recognize, admire, connect, and support the women in our lives, but most importantly, push for gender equality. Because regardless of how forward-thinking you think you are, the truth is that we are far from achieving this. Unless you think it's okay for women to be paid on average 24% less than men, or for 1/3 of them to experience violence in their lifetime, most likely by someone they already know. If you want to find out more about how you can support women, go check today's big issue, and they have plenty of ideas in there. That way, you support both women, but also fight poverty. Win-win. You want a third win? Well, go to YouTube or Spotify and check what the Assyriologist, Dr. Moody, had to say about how our Mesopotamian ancestors were dealing with mental health 4,000 years ago. Back to 2021, and with me today, a stellar example of what a woman can achieve. I'm going to follow a bullet point approach, as there is no other way, to be honest. I can fit everything in there. So let's start. Woman, medical doctor, neuroscience researcher, immediate past president of the Medical Women's Federation, Psychiatry president of the Royal Society of Medicine, Psychiatrist of the Year 2020 award from the Royal College of Psychiatrists, recipient of any national and international prizes and awards you can think of. I mean, you get the picture. And I've only scratched the surface. Most relevant, though, to today's topic, she is the founder and director of the National Center for Gaming Disorders, the first relevant NHS clinic in the UK. BRAINCAST people, Professor Henrietta Bowden-Jones. Prof, welcome to BRAINCAST.
Pospo, thank you so much. I'm so excited to be here. I'm really looking forward to the next half hour, and thank you for making time for gaming disorder on your show.
At your services. So, Prof, let's start with a seemingly simple yet really important question, as it's going to set the scene of what we will be discussing today. So, what is gaming?
So, as a non-gamer, the approach I'm going to take to answer this question will be different from yours, that you yourself being a gamer. So gaming, obviously, it's something that is done by the majority of people, of young people, particularly if we just look at this country for a moment. We know that it's a recreational activity that many people enjoy. It can have very positive impact. We'll talk about that later. From my perspective, as the person who has set up the only NHS clinic for gaming disorders, gaming, I perceive it slightly differently in relation to my patients. So it's a way of escaping for some extremely complex situations at times, not just because in their real life they're experiencing problems and they can escape by doing another activity, but because often they talk about a perfect life. So it's very moving to hear people who may be in foster care, people who may be struggling with parental arguments, violence in the family, or self-esteem issues, talking about their perfect life online. And this opportunity, this second chance, for many is important. The other thing I'll talk about in terms of gaming is, as you know, it has a very strong social component nowadays. And so a lot of these children are very isolated, often because of societal and indeed environmental issues linked to stress, linked to bullying, linked to being misfits at times, not all by any means, but the ones I'm thinking about. And this connects them to other people who game, who share their love without being so obviously outcast as they are during their daily experiences at school. I'm talking young people here, but of course I do also have older patients.
Fascinating. I mean, Prof, it is really common practice, I have to say, for modern societies to turn the blame upwards. So rather than addressing, fundamental flaws like inequality, racism, poverty, etc., there have been endless debates about how music, lyrics, movies cultivate a culture of violence and aggression, at times leading, I have to say, to unnecessary censorship. Now, in 2014, Malte Elson found conflicting evidence in his 25 years of research on violence in digital games and aggression paper, while a most recent paper in 2019, if I remember correctly, studying 1,000 youngsters, found no evidence linking violent video games with aggression in adolescents. So what do you think?
Absolutely, what you say is right. And so this gives me the opportunity of talking about the need for large-scale research in specific areas of behavioral addictions. Gaming, we'll talk about it further on in this interview, but there is a dearth of independent research that looks at issues that are highly relevant. And yes, I am aware of that study, and I don't hold a position either way. The fact is that when it comes, you are talking about people who game and whether they are more violent. The population I deal with, I'm going to tell you something quite shocking now, and that I was not expecting. I set up the National Center for Gaming Disorders in 2019. I thought that I knew enough about gaming disorder, having sat on the advisory board for behavioral addictions for the WHO. I knew the intellectual part, the academic part, but what I didn't understand was the presentation of these children. And I'll tell you now, from the data we have just on the last year and a bit, 50% of our children have been violent towards their parents or siblings, but significantly violent. Well, in some cases, the police has been called repeatedly. In some cases, there has been foster care involved. Now, of course, we're not talking causality here. I wouldn't dream of doing that. But what I'm telling you is that by the time you've lost control, and gaming is your absolute compulsion, if anyone tries to take away the means in which you game, you can potentially become violent, and it's very hard. We have parents in tears all the time, not knowing how to deal with it. So wow. I've slightly moved away from your association between gaming and violence, because I don't think there is as yet, an exact answer. I really don't know. Probably not, if the latest study tells us not. 1,000 people is a lot of people, but if that study was replicated on a wider scale globally, that would be an easier way to accept the results. As you know, sometimes with these less studied topics, you do need a few study replicating. So, but this issue of the behaviors that we are dealing with, it is shocking, and it is about violence, and therefore one of our very big jobs is to try and contain that violence in order to allow children to stay in the family home where indeed they want to remain.
But Prof, before we go into the dark side, let's shed a bit of positivity, and a bit of light. The truth is that it's not all doom and gloom. Gaming, and obviously not the gaming addiction that we're going to talk about, can undoubtedly have some benefits. So can you tell us what are these?
So yes, and now not for my patients, I'm afraid. And I think, I draw the line. It's a bit like asking me what are the benefits of gambling for my patients with gambling disorder at the National Problem Gambling Clinic? 0. Okay. But if we look at a bigger population, there are opportunities for achievement. There's a safe way in which to compete and to learn about one's competitiveness. There's a safe way of developing cognitive skills that allow you to use them in a sort of real life environment. You can build your self-esteem. You can build your social networks. All these things are possible, but not for my population. So you will get a very skewed view today from me. But also, I think, having set up this clinic and having arrived at it from an addictions background, I'm a doctor, I'm a psychiatrist, I'm an addiction specialist. The behavioral addictions concept comes very much as one more mental illness for me. However, there are some amazing colleagues at the Royal College who are doing great work using gaming to do all sorts of good things. I'm just not, it's just that I personally am not an expert on that side of things.
So on the same positive note, last November, it was all over the BBC News that, in fact, playing video games is good for your well-being, with participants playing a particular game, of course, called Animal Crossing for 4 hours a day, every single day. They were more likely to say that they feel significantly happier than someone who didn't. However, it was reported that those who felt compelled to play, for example, because they were seeking to avoid stress elsewhere in their lives, as you alluded to earlier, that they had reported being less content. So is that where we cross the line? Is that where the issues start arising?
Yes, I'm very pleased you brought up this piece of work, because maybe it does point to that threshold, let's say. So we know, and I will at times in answering your questions, I may dip into other behavioral addictions because there is more research in gambling, even though there isn't enough than there is in gaming. But what we do know is that when gaming disorder, or let's say gambling disorder, is set, is present, the enjoyment side of things disappears. That loss of control that is critical, the loss of control moment, is when you go from doing something recreationally that you used to enjoy to doing something compulsively. And the loss of control is inherently linked to harm, because it entails an inability to apportion enough time, mental focus, or physical time on things that matter. Now, with this younger population, we're talking about academic work often, and most of the people I see either have refused to go to school for a very long time and have social services involved, or are attending school and are underperforming in relation to their cognitive ability. Now, this is not something they live happily. This is causing them enormous distress. So they are living a dual situation where they are compulsively doing the gaming to self-medicate, something that is worse as the environment brings more stress, as they drop out of the sports teams. A lot of our people are quite competitive, so many would have done well in sports teams or other things. Some of them will have been doing well at school, and suddenly their position in class falls. So there is that moment where you realize the negativity and the loss of control. There is no enjoyment at that point. It's merely something that is better than how it, it's better than not having it. So I think that's right. Whereas remember, plenty of people can game for hours very happily. If you are in control, it's no different from reading a book or watching Netflix. There is nothing prohibitionistic about an NHS approach to treating gambling disorder. We accept that it is really a small number of people who have those vulnerabilities. Now, I'm not suggesting the industry doesn't have a role, and we will be discussing that later, but certainly, not everyone who is playing a lot needs to be considered suffering harm from gaming.
Prof, as I was preparing for our conversation, I was thinking to myself, so why do we need all this? Essentially, all behaviors can at some point become pathological. So why do we need all these different fancy categories? And then, of course, as I was thinking about it, I came across that editorial by Griffiths and Pontes titled Internet Addiction, with really big letters. Internet addiction and internet gaming disorder are not the same. And then others, other papers purporting that, mobile gaming and console gaming is not the same, and so on and so forth. So that's endless.
Yeah, so it's very confusing. I mean, luckily it's not confusing for me that, you know, having set up the clinic, but it took me a very, it took us, the team, a very long time to get some clarity. Again, luckily, may I just refer to the WHO special interest, you know, special advisory group, because a lot of that work was, you know, was initially done there for me to understand what I needed to do in England for this clinic. So, you know, we know there are great papers by people like Daniel King, psychologist, but one of the eminent world experts on screening tools, prevalences, etc., on gaming disorders. So, you know, a very recent paper identifies, I think, 27 screening tools for gaming disorder, you know, 45 tools if we look at a bigger picture. And so the issue, and you know, I'm sure we'll have a moment to talk about prevalence, but there is a real lack of understanding when we speak about gaming disorder, because people do tend to conflate internet use, excessive internet use, which could be anything. It could be, you know, social media time, with gaming, and this means that many of the screening tools that are being used, particularly when you see these crazy prevalences of, you know, 27%, I think is the highest I've ever seen.
Wow.
I can't remember where, in some, anyway. But the point is, one of the issues is that that they are asking about all activities online, and that, of course, is missing the point. So why do we need, for example, a clinic like the National Centre for Gaming Disorders? Well, until the clinic existed, I was unable to treat what I thought would end up being a very small number of children. As it happens, you know, NHS England, in their long-term plan in 2019, factored in 15 more clinics, 14 more clinics for gambling to replicate my national problem gambling clinic. It was like 11 years after I started the first one, but eventually we got the replication. It took a while. But with the National Centre for Gaming Disorders, you know, they really understood that I was begging them to, you know, to provide something. So they apportioned a little bit of money, and I said, I'm sure it's going to be enough. They allowed us to see 50 people a year. The sad reality is that we've gone 3 times over that in terms of our work. And so it's not an epidemic in any way. Many people don't even know we exist. We had a Sunday Times, so this might be interesting for some people listening. Not yesterday, but the Sunday before, the Sunday Times ran a 5-page piece on our clinic and on gaming disorders. And the next day there were 25 new referrals. So partly people don't know about us, but also I really don't think it's an issue that affects an enormous amount of people. But exactly how many, we don't know. With the gambling clinic over a decade ago, I thought I could do it in my special interest, and many people were saying, yes, Henrietta, why do you need a clinic? Just do it as a special interest, you know. And within a year we were up to hundreds, and soon after that, you know, we were sort of 900 referrals a year. So, you know, and now all we need is we can see, as you know, there are 500,000 people with gambling disorder in the country, and 2 million people who are at risk, already scoring for harm. So what will happen to gaming disorder, we don't know. But certainly without a diagnosis, a lot of the CAMS teams can't even refer to us. They can't even begin that conversation to involve social services. They can't put people out to put them into foster care when they're hurting their parents, physically harming them, or trying to jump out of windows. So that's why really it has been such a privilege to be able to lead this clinic, and also very much to have something recognized that, by the way, I had been shouting about for about 5 years. There's a piece in the Daily Mail, I think it dates back 6 or 7 years, where I'm going, we need a children for young people gaming, and people were just laughing at it. But you see, and maybe this, I'm not sure who's listening today, but there will be quite a lot of trainees. You know, if you need to follow your gut instinct. If you think something deserves attention, don't give up if people tell you it doesn't, because, you know, pursuing that as an expert will eventually give you the tools to convince people that something is necessary. Yes.
But You're right that that issues around defining and diagnosing the disorder itself, and of course heterogeneity in the relevant studies did lead to lack of clarity about how often we see the gaming disorder in this population. And essentially, it was a recent study, I think last year, published in the Australian and New Zealand Journal of Psychiatry, that Matthew Stevens reported that the global prevalence of gaming disorder is between 2 and 3%, something like that. But on a similar note, though, something that I found really interesting, it was only earlier this month that Yong published a paper in Frontiers, where the team found that 39% of young adults reported smartphone addiction with a significant associated impact on sleep. Now, what I find interesting, though, is the inverse association between age and addiction. So is it something only relevant to youngsters? So gaming addiction, is it only relevant to youth? Or are we expecting gaming addiction to become something more universal as we all grow older?
I love your question. I think we need some longitudinal, well-funded independent studies to answer that. We know that in behavioral addictions, we have spontaneous remission in a way that is far more frequent than with alcohol or drugs. And so there will be people coming in and out of what is actually a scoring for caseness for disorder. So that's fascinating. We also have an enormous amount of youngsters who, as they mature, their frontal lobes develop more, their life changes, they have more significant relationships, they have a stronger role in life, will move away from what they're finding emotionally nurturing, their friendships on gaming platforms, and will move to other behaviors where they can be more productive. So all of that is important, but to be honest, longitudinal studies in specific populations are vital. What we can't do is to say, because in China people are doing this and they are switching at a certain age from this product to that product, this will happen in the UK. No, and I, by the way, feel it's inexcusable that neither gambling disorder nor gaming disorder has had the apportioning of funds that it needs for us to understand the extent of harm. Harm to society, harm in terms of who is vulnerable, the evidence base around what interventions work in terms of prevention and treatment. None of this has happened. I mean, we are really in the dark ages in relation to this. However, Pospo, going back to your original question, the 2 to 3% is a prevalence that has been quoted by more than one expert as a possibility. Okay. So I would like to be more optimistic. I'd like to hope that it's less than 3%. I'd like to hope that it might be 1%. But even then, of course, it would be an enormous amount of children in need of help. I'm sure we'll have an opportunity of talking about the comorbidity side, but certainly you need both large-scale prevalence surveys. They need to be funded independently of industry, and they need to also have a longitudinal component, because we need to know whether the same populations are coming back. Now, one thing about the age, I still remember getting a call from a man who was in his 40s, who was driving down the motorway, and he heard me speak, being interviewed on the Radio 4 program about gaming disorder, and he said he had to pull over in tears because for the first time in his life he had heard about the fact that what was ruining his life was actually an illness. And it was his call that got me to speak to NHS England and say, look, we thought it was going to be only children. Yes, we can treat from 13 upwards, but let's not stop at 25. This is what we were doing. We were stopping the commissioning at 25. Let me treat this man. And of course, after him came others, 38-year-olds who don't brush their teeth for a year because they're gaming in the morning, 65-year-old women who are on Candy Crush and can't stop. People spending thousands and thousands of pounds on games they don't want, on in-game purchases that they don't have. So
Prof, what I find really interesting and fascinating is the differences between the two sexes, as it has been consistently reported that boys are more prone to develop gaming addiction than girls. What struck me, though, was a 2016 study by Andreasen, published in Psychology of Addictive Behaviors, where they studied a really large, population. It was 24,000 adults or something like that in an online cross-sectional survey. So now what they found is that being male was significantly associated with addictive use of video games, whereas being female was significantly associated with addictive use of social media. Yeah. Can you tell me more?
Well, there have been sort of twin studies on thousands of twins that also happen to have seen that the compulsive element is shared and very similar, but that the choice of how one does that carries out the compulsion does tend to draw boys towards gaming. So that there have been more than one study looking at that, and I must say I have undoubtedly found some cultural within behavioral addictions in general. There are cultural barriers. Certainly in adults, I think people find it harder to come forward. Women find the stigma attached. Let me mention gambling disorder for a moment. We would be treating a lot more women if the stigma wasn't so great, if they weren't so scared of telling their partners, their spouses, their parents about this problem. And then it gets worse, they get into debt and they end up in court. They worry about being considered bad mothers, not spending time thinking about their children. So with gaming, because the age is earlier, one potentially could be lowering that stigma just because of the earlier onset. We are seeing girls, but we don't see as many girls as boys by far. We may be seeing maybe something like 2 in 10, something like that. When they come, they're quite severe. And the presentation then is identical. There is, impulsivity, inability to delay gratification. There are often environmental circumstances that are really impacting on their wish to escape their reality. But the people under the duvets that you read about, the ones who are gaming and are not eating with their families, they're not going outside, those tend in general to be boys up to now. But that does not mean that there are no girls doing that. It's just in terms of my experience in a new film. That's an important message. Yeah,
of course. In 2019, Jin-Liang Wang showed that adolescents with mobile game addiction had higher self-reported depression, social anxiety, and loneliness. So what about the other way around? So would you say, and actually one of our attendees, actually Alan, is asking if we can talk about, gaming, ADHD. I won't make it that really specific. My question would be something more like, obviously, if you know about the link, go for it. If there is a possible bi-directional relationship between gaming addiction and other mental health issues.
Absolutely. And we, again, we will need some high quality research in this field. But we know, we already know that the people we are seeing who are presenting with low self-esteem, with an enormous amount of social anxiety, depression, significant wish to self-harm, suicidal thoughts, in young people. Again, this took me by surprise when I first opened the clinic. I wasn't expecting such incredible, extremes. But equally, what we know, and of course so we're seeing all of this, but this is in people with gaming disorder already. So there are consequences to cutting yourself away from all the positive things that you used to do. And there are possible consequences, such as the ones I've discussed. But of course, the bidirectionality comes in because we see people with autism, we see people on the spectrum, we see people with ADHD, we see people with already diagnosed depression set in. You know, an example would be people who have ended up, and many of our patients are people who are very highly bullied at school, who develop all sorts of symptoms prior to turning to gaming as an escape and a self-medication. We have people who are living through acrimonious divorces, who are taking refuge in gaming because the family, the house, is a very scary place. There are people, several people I've spoken to, because I'm still doing most of the assessments, nearly all the assessments, so I'm very much getting the sort of frontline feel. You know, people moving to a new area, so they've had the marriage of the parents collapses. They are then moving with their mother, always their mother, in a place that is scary to them because it's often a bit unsafe. You know, they don't feel they know anyone. They prefer to, so suddenly their life is brought online as a coping strategy, and at times to keep them safe, to stay away from gangs. You know, you hear that quite a lot. So we've got this definite bidirectionality here, absolutely true, and I'm glad that has been raised. But not, you know, when I started the clinic, people would say, everyone you're going to see will have autism. That is most definitely not the case. But the majority of people we see, many people we see, have not had a very easy life. Some have, and I would argue that the ones who have had an easier life may be the ones who have been most impacted by the genetics of the transmission. We know there's a, you know, significant genetic component, and that genetic component may be impacting on some more than others. So with behavior addictions, if we think of gambling disorder, there aren't many, there isn't one single way into gambling disorder. There are many. And when I see, you know, when I see a 17-year-old who has stolen his father's credit card and has lost £100,000 in one night, I will always look for a gambling grandfather, you know, and you will nearly always find one. And that child may have had a great life, no early life traumas, but that genetic transmission will have been there. So with gaming, you know, we need to kind of become a lot more sophisticated. And I think genetics will play a very big part in our true understanding of the vulnerabilities, and potentially also what kinds of treatments we decide to go for. Because you know, in gambling, we use naltrexone quite openly now, and people who didn't do very well with psychological interventions stop like that when they have that very, very powerful urge. And so what is going to happen with gaming? Is it possible that a subsection of gamers stop that way if they are so out of control?
Prof, as we expected, we completely ran out of time, so we completely failed to finish all our questions. However, there is so much passion in you that really, I don't care. I'm going to continue if you're happy with that for another 4 to 5 minutes. I have a clinic, so I really need to go later.
I'm very happy with that. I would like to add, for anyone listening, we do have an email address. It's NCBA, National Center for Behavioral Addictions, ncba.cnwl, Central Northwest London, which is our trust, at nhs.net, or you can just look me up and you know, and email me, and I will be delighted. I've got 2 or 3 colleagues at the moment who are helping me at the clinic. I always need more. We are severely underfunded for what we see, and there is room for learning. So anyone enthusiastic can come and find me.
Fantastic. So, Prof, another 5 minutes, and then I promise we're done. So there's one thing that I like, is being devil's advocate. Not that I necessarily agree with the devil's views, but still, it always adds a bit more spice. So the 10 top earning gamers, so professional gamers, they have a combined 270 million followers across YouTube, Twitch, and Mixer. And they earned $121 million last year. So are they addicted, or are they just professionals?
I'm so glad you asked me this. Okay, I'm delighted to be asked this. Of course, it depends on the individual. There may be some people who are suffering harm and they're professional gamers. So please remove those from my generalization. But ultimately, it is now a profession that can be very lucrative. We know that whole teams are being raised and brought together, like in the old days, the poker players who in Las Vegas would all live together. They'd be part of teams. They would sleep during the day. They would play at night with their black caps, etc. If you enter something like that in order to make money or because you enjoy it and you don't suffer any harm at all, it would be ridiculous to call that an addiction. If you don't have proper harm, then it's not an addiction. It's a choice of life, and who are we to decide what they should be doing? And certainly I learned a lot when I met some of these professional. This is many years ago before setting up my gambling clinic, I needed to understand that difference. So I spoke to some and I was very clear there was no addiction there. Yeah.
Fantastic. So government and industry. So in South Korea, the government has introduced a law banning access for children under 16 from online games between midnight and 6 a.m. in the morning. In Japan, players are arrested if they spend more than a certain amount of time each month playing games. And in China, internet giant Tencent has limited the hours that children can play their most popular games. And the industry, on the other hand, according to Forbes, the video games industry's value will exceed $200 billion by 2023. So how can governments and the industry support the work you're doing?
So I'm glad you bring up those examples. Those are very extreme examples. And I was discussing them at one of the WHO meetings with the counterparts from those countries. It does appear to be maybe more geographically specific and linked to culture. What I was told was that there is no time. The academic pressures are so great from such a young age. There is no time to go and play. There is no time for sport anymore. Parents want their children in the best possible university. And so the only escape they have at the moment is through that gaming. And what you're seeing is everything has gone from real life onto gaming platforms for very limited times because the academic work takes priority. I was very interested in hearing about that. Now, when it comes to our industry, I don't think we're anywhere near needing to do anything so draconian, but there is a lot that the gaming industry should do. The first thing is that maximum daily spend limits on all games and the ability to stop any spending. The parents in tears telling me that their money, their benefits money or their savings are being spent thousands of pounds a month sometimes. So it's got to be it's got to be on by default, so that if you're an adult, you can turn it off if you want to spend money. But if you're a child, you can't spend. So that's important. I think the age rating system for all games must be legally enforceable. So you, in the gaming industry, you will be shut down if you are selling your stuff that has absolutely harmful structural characteristics. And I think that's important. So that attention to structural characteristics is vital, both in gambling and gaming. I think data sharing is going to be a great way forward. And I think there is some appetite on the part of the gaming industry, I hear, for some data sharing, because large data sets would allow us to understand what behavioral tracking is needed to identify people who are clearly doing things that are harmful for too much time or for whatever reason. I think geolocation tracking has to come off. I mean, there are some risks that children are placed under. I have a lot of young people who are chatting to adults online. Their parents are not even in the house at times. So all that needs. So I think there needs to be a loot box regulation. The government's doing that at the moment, doing a consultation to see. And overall, I think we do need a good, reliable harm index for products and a governmental body that keeps an eye on people behaving in the industry, really. I think that's enough.
before I lose my job. So one last question, and you have bullet point 30 seconds, because in the end of the day, you are the founder and director of the National Centre for Gaming Disorders, which is essentially the first NHS clinic in the UK treating gaming disorder. So in 30 seconds, because I don't want to be without a job, what's on offer and how can people be referred to your clinic?
Okay, 30 seconds. ncba.cnwl@nhs.net if you want to refer, or Google me, you'll find me. Secondly, it's cognitive behavioral therapy. It's online. It works better online than it does face-to-face for these children. We offer treatment for parents and children, group and one-to-one. And if your child is younger than 13, we will treat you, the family, in order to help the child. Done.
Unbelievable. BRAINCAST people, Professor Henrietta Bowden-Jones. One more reason to celebrate International Women's Day. And from the futuristic virtual realities of the Xboxes and PlayStations of this world, we're going back to basics. Psychopathology, maybe the most underestimated yet most frequently used tool of every practicing psychiatrist. With me, a Royal College of Psychiatrists Lifetime Achievement Award recipient and author of one of the most famous books in descriptive psychopathology, Symptoms in the Mind, and Professor Femi Oyebode. Until then, Pospo and BRAINCAST for multi-learning, over and out.